Dr. Boja gets here, we are very racially diverse up here. However, there's no women on the stage this time. So we need to fix that for next year maybe, right? Yeah, maybe. So, all right, Dr. Boja, come on up. Yes, we were waiting for you. We weren't going to start without you. All right, so, all right, guys, have you seen these questions previously?
No.
No, good,
I don't think so, yeah.
Good, because I want it to be a surprise, all right? So let's just start. I don't know, you guys can just jump in because you have different specialties, things like that. First question says, can a patient with obesity and ESRD go back to CKD stage and get better? In addition, for PT who has for patient, I think that says, who has a low EF or CABG, can they be able to get better and leave prescribed meds? I don't know if I read that question right, that first one. I don't know if you guys, did you guys get that?
That's a multi-barrel. I mean, you had too many questions in one question.
Okay, can we just pause for
that
just 1 second?
That tells how loaded
One moment. Can you just explain what ESRD actually is first, and then what CKD, because we're not medical people up here.
Dr.
So we
Henry can jump in as well. So,
yes.
they're talking about heart issue and then the kidney issue. So ESRD should, represent end-stage renal disease. In other words, the questioner is concerned about complete kidney failure. Unfortunately, that's the kind of terminal stage where you're actually waiting for the dialysis. And the question embedded in that was, can I go back to CKD, chronic kidney disease, meaning a little bit earlier stage? So that was the question. I guess the real question is, can I reverse my renal failure? So that's the simplest form of the question. I'm not sure if we can promise that, because people who are on the CKD, chronic kidney disease, stage 1, 2, 3, before you get into the end stage, they do see a lot of improvement. Once you're called end-stage renal disease, it could be difficult. I wouldn't say impossible, but I don't expect any huge miracles. But one thing I can tell you for sure, I think Dr. Henry, you can jump in, for heart failure, even diabetics for 20, 30 years, or somebody on type 1 diabetes, ended up on insulin. Can I get better? There is always an opportunity. We look at one lab value, one organ function at a time, but the human body is very complex. So there's a lot of, positive effects you see. One of the examples we can say is, I was diagnosed with a cancer. I'm on chemo, radiation, and surgery and all that. Does it help? Lifestyle change can help, yes. Your response rate to the chemo would be better. I think your remission, your recurrence would be down. And the same is true for the kidney failure as well. Probably they don't need to struggle on your dialysis sessions. And you actually live longer and much healthier on dialysis, even if you end up on dialysis. I hope that answered the question.
Yeah, to talk more about the EF is what we call ejection fraction. That's a measure of how well your heart pumps. The bigger the number, the better. CABG, or what we shortly call mesenteric CABG, means coronary artery bypass grafting, which is an open heart surgery to bypass blocked up arteries. You have to think of 3 stages. There's something that we call injury. That's where something's hurt, obviously. Actually, exercise is a form of injury. Then you recover and you get stronger from it. Now, there's something we call damage, where that injury has now led to a permanent amount of dysfunction. And in that, there's what we call reversible and irreversible damage. Now, with lifestyle medicine and regular pharmacologic medicine, there is some things that are reversible. We can make the ejection fraction, like you suppose you have a big heart attack, EF went from normal 55% down to 20%. With lifestyle meds and stuff, we can get that back to normal often. But sometimes we can't. And this is why prevention is so important. You can have an irreversible event, and no matter what we do, we're not going to be able to make you recover or fix that. Now, what Dr. Boja said is really important is even stroke. You can actually kill off part of your brain, and your brain's incredible. It can reroute some of the function, and you can have basically recovery, functional recovery, that's really outside the anatomy of what's been damaged. So not everything is totally cut and dried, but there are things that you can't come back from, and that's why prevention is so important.
See, I think actually, do you have something to add to that at all, by the way? Okay, yeah. I don't even know how much time we actually have. We'll take as much time as we want. All right, so I was thinking to myself, maybe David should have been the one doing this because David has a medical background and I was stumbling over these. I don't know what I'm talking about right now. But I represent the normal, the regular non-doctor people here, so yes, that's why I'm here. All right. All right, so to any presenter, especially it says Dr. Khan, could you speak more about the impact of trauma, especially childhood trauma, on health and fitness?
AJ, you're looking at me for some reason, so I'm just going to go for it.
Yeah, go right ahead.
This has actually been really well studied. There's something called ACE, Adverse Childhood Events. And that tracks very well with having chronic disease and early death later in life. And we're talking about things like, as a kid, your family went through divorce, you were beaten, you saw violence in your life. The more of these you start stacking up, it's amazing. The higher your ACE score, the much more likely you have emphysema, heart disease, diabetes, stroke, and death. And that's well described. And the short term, what we call that trauma. And we can all kind of relate to this. We've all had trauma in our lives that has physiologically, emotionally, socially hurt us. And until that's resolved, and sometimes that can't be resolved, that is going to be an impediment to your whole holistic health. So I think the trauma is really important. I'm going to make one more comment. It's not really political. It kind of is, but there is something called weathering. And that's when people are under chronic stress. That term is typically used for people that have been facing racism for their whole life. You can't live in a high-stress environment for a long period of time without getting sick and being unhealthy. So efforts to break down the income gap, to be more diverse, to recognize that some people, like me, have some advantages. I hate the word privilege, but people are born with some advantages. To understand that those differences make a huge impact on how easy your life is. To say that's not important, I think really only comes from a person whose life has been really, really easy, and it's easy for those people to say that. Everyone else needs to really be aware that these things have a huge impact on our overall health.
Yeah, if I could add to that, and spot on, and it's unfortunate that the conversation around equity, health equity, and the the disproportionate impacts on different populations has become politicized, right? There's well-founded bipartisan research around that. Just to add on to the ACE study, though, and I used to work in Health and Human Services as a child abuse prevention coordinator and cultural competency officer for a county department of behavioral health. And we saw it time and time again, right? Kids that experienced adversity early on in life had fared worse in all health and social outcomes in ways that, in significant ways. One of the things that got me interested in this line of work in outdoor recreation was after taking a group of kids that were in the foster care system. I was volunteering with an organization. We took a group of kids out hiking, and just seeing the feeling of awe on their faces, seeing the feeling of or seeing them experience competency and the ability to do that much more. What we saw were the elements of what we call resilience. So we talk about ACEs, adverse childhood experiences, and how that is unfortunately a predictor for many health outcomes. But then there's this entire body of research around resilience and how resilience can be fostered through feelings of self-efficacy and self-competence, right? So that's built through outdoor recreation, through team sports, and other recreational opportunities. We see that also developed through community and through mentorship as well. And so all of that is interconnected, right? So for any of us to think about, if any of you are on a journey for improving your lifestyle, improving your health, tackling that journey without thinking about and also addressing the impact of trauma as it may present in your life would not be holistic. I'll give one more example. So Dr. Vincent Folletti and Dr. Robert Onda were the two researchers that really led the adverse childhood experiences study. Dr. Vincent Folletti, what brought him into this body of work was he was actually a physician focused on obesity, and he was running a clinic for people who were clinically obese. And what he saw was, as they were going through as they were going through his programming, they would lose a tremendous amount of weight and would be doing really well, and then that weight would come right back. And they were wondering, well, why does it come back? And why does it come back for some patients but not others? And that was where he began asking questions about, have you experienced violence in your lifetime? What was your home life like? And started seeing a correlation that then he quantified through the adverse childhood experiences study, which has been replicated many times over and now includes questions about racial trauma as well and the impact there.
I think I wanted to look at it, look at one aspect even with pain. In one of the study, they actually realized that for those who have actually have that ACE, early part, they actually increase nerve sensitivity at the early part. So mostly because they were exposed, their nerves become like heightened. So every traumatic experience that they have as they age add up. So by the time they get to adulthood, their innervations have become so sensitive that anything just triggers it. So people who have even have like fibromyalgia, they've had complex regional pain syndromes and all of that, you go further and you realize that all of that was because of some of these ACE experiences that they actually have made their nerves so much sensitive. So what they are experiencing now is just the last drop that is making everything overflow. So that is why some of these things need to be addressed, like even with our kids and our young people, as much as possible, if we can actually reduce some of this trauma, it increases or decreases the sensitivity of their nervous system to some of the experiences that they are going to have later on in life.
Can I jump on this? What Ben and what Les is talking about, this cup example, everyone's got resilience. They have some capacity to handle stress. When you have a ton of stress already, any little thing is going to break your back. And then that just makes the whole house crumble. And then we look at them like, what's their problem? We have to be a little bit more gracious and understand people have gone through a lot, and what we're seeing may be a little thing, but they just cannot tolerate anymore that day.
Yeah, if I can add something, I can't agree enough with those comments and actually insights, but if I can add my 2 cents as a clinician, your health is not just hiding in your labs or images. That's exactly what shows up on your medical records. There's a whole, because humans are social beings. The human physiology is more complex than what you can see, find on your labs and your imaging system. We have incredible imaging technology, but you can't find answers for those and solutions on those numbers. So taking that holistic approach, the flip side is, if you fix that, just like I was emphasizing yesterday, if you actually fix the lifestyle, you probably don't need all this chaos. But if you miss that, you don't find the solution elsewhere. So you cannot forget the old trauma or past trauma or the current trauma or the stress, because that's an invisible enemy within.
In the clinic, some of the funny things that we give analogies is that those images, like you mentioned, is that it's just like going to a restaurant. You have the nice menu and everything and how the pictures of the food, but there's one important component that the menu and all the pictures don't tell you, is the taste of the food. You can never predict the taste of the food just by looking at the menu or even looking at the picture and how nice it looks. So it's the same thing. A lot of times, some of these experiences that people do have, it is when you have that experience, the lifetime experience, that you can actually predict what exactly is going on. But sometimes just looking at the images of their MRI report and CT scan report sometimes do not give you a more holistic picture of what they are dealing with.
Thank you, guys. I was going to take that discussion to a totally different place. No, but a serious one, though, about how I was just thinking about the impact, everything that you guys said about the impact that, I'll just say, like the spiritual component then can have on that when you're looking at things like you've had trauma, but how important now forgiveness is. in order to heal from those things. And how important now when you come to church and you say people can't take anything else, how we can show them grace because we don't really know what they've been through for that particular week. And so I was just thinking about all those things, how they can kind of blend into the spiritual realm and aspect.
If you have a second, actually, if you think of in a spirituality, the place we are here, there is a bonding, connecting force, right? Spirituality is not just a feel-good sensation. If you connect it to the modern medicine, what it affects, our influences, is actually our core immune system. All these drugs, these modern drugs, especially immunology, these chemotherapy and immunotherapies, and the diseases and the cancers, they're directly linked to your immune system and your bone marrow, how your body is responding to them. And that's where actually our spirituality hits, and that's why people who are actually more spiritual, actually following a certain belief system, respond well to the treatment. Sometimes they don't even need the treatment. So I think you see these magic, miracles happening. In the majority, I think that there is a spirituality directly affecting our human hormonal system, endocrine system, and the immune system. That's what we are trying to fix with drugs. So you can't undermine that.
Yeah. Something I'll name also, just maybe taking this conversation slightly a bit of a different direction though also is, so yes, spirituality and faith are incredible predictors of positive health outcomes, period. And I think it's really important for us to know, especially for people of faith, and I belong to the Seventh-day Adventist Church and am an avid practitioner. Something that is really important for us to be aware of also is that faith and religious communities also can perpetuate harm and trauma as well. And so it is so critical for us to also keep that lens in mind as well. One of the statistics that we looked at and often talked about in child abuse prevention and ACEs also, child abuse often happens in church and faith communities. And I think the statistic was 66 or 67% of all cases of child abuse outside of the home took place in communities where the kid knew someone, where there was a consistent relationship. And so churches and schools and youth centers are three of the most common areas where child abuse often happens. And so that should also be a call to action to us to just be aware of and to be sensitive to that. And therapy, is something that I'm a huge proponent of. And as we're talking about recreation and outdoor recreation today, I want to make sure that we also highlight, the importance, the really central importance of therapy in moving past trauma.
I know we spent a lot of time on that question, so I'm going to wrap this one up just by saying that even though traumatic things have happened maybe to you in church, doesn't mean that we want you to stop coming. We don't have that same attitude about school. Something happens bad at school, we just keep going back and back. So just maybe have that same attitude about church. All right, Dr. Boja, there's a question about diabetes, and I'm sure all of you maybe can answer as well. What advice can you give an insulin-dependent diabetic whose body is killing its natural insulin made by the body to reduce medication use?
Well, I think that's one of the, on the surface, it looks like a hard question, but that's an obvious question for many. If I read it correctly, I think they're referring to the type 1, or somehow, you can actually have something called type 1.5, might sound strange, or LADA, latent onset and adult onset type 1 type. In other words, I think the question that they're asking is, my body's destroying my own insulin, and I'm on insulin. Can I do anything about it? Right? Yes, the answer is yes. Just because you ended up on insulin, whether you're as an adult or a child or a type 1, for whatever reason, you can. Because just because you ended up on insulin, that's not the end of it. I have patients. We're blessed with a lot of patients now. We're getting type 1s. They joined our program with 150 or 200 units of insulin per day. And I recently heard one of the endocrinologists, actually, the diabetic specialist, he said, if you give that much insulin to a cow, that would die. And he said one of the reasons why he switched to lifestyle medicine was, when I read that, I think I was shocked, because that's what I do to my patients. How come humans are not dying? So we have other forces to kind of balance it out. But the point is, just because you end up on insulin is not the end, because What if instead of taking 150 units of insulin, you can manage with just 20, 30 units of insulin? Because insulin is a growth hormone. It actually makes you gain weight, more fat. And then excess insulin causes a lot of other health problems and going to the heart disease as well. There are many ways that you can actually mitigate, and because there is a second invisible enemy underlying, which is actually a type 2 element. Type 1 diabetic can actually turn into double diabetes, meaning eventually, just like anybody else, you can build insulin resistance and you become 2 in 1. You have type 1 to start with, and then you have insulin resistance, adding on to that to become type 2. So your insulin need would go high. So by changing the lifestyle, your diet, your life, exercise, your sleep, your stress management, under professional supervision, you can actually reduce the insulin resistance, reduce the need for insulin, and there's a whole lot that you can actually improve.
Yeah, just to add on to that, so there's type 1, like you mentioned, type 2, which is the biggest part of diabetes now. Then 1.5 is the burned out type 2s, where you just trashed your pancreas by your lifestyle and you just can't make any insulin anymore. The reason that lifestyle is so important and why insulin is so bad for you, basically you have a big sugar load, huge sugar spike, your body pumps out a bunch of insulin to get the sugar into the cells, and then insulin is a growth factor, it's going to make you gain weight. If you've seen if yourself is a type 2 diabetic, or your family or friends are type 2 diabetics, as they have increasing insulin resistance, increasing dose of insulin, they gain weight. That starts a cycle where they need more insulin, more weight gain, more insulin, more weight gain, and goes out of control. When I was a med student, people on 30 units of insulin were like, wow. Now type 2s, 100, 120 units, we see that all the time. So by cutting back your sugar load or doing things like intermittent fasting, where you have less spikes of eating, those are ways to try to decrease that pattern. So they're just something to think about.
And that's why we're like talking about just doing their exercises and other things, because those are the things that are actually going to increase the cellular sensitivity to the insulin. Like Dr. Boja mentioned yesterday, you just want the doorway to open, and data upon data, we've shown that how the exercises actually helps to open the doors so that these things will come into the cells. The cells actually do that. So for instance, sometimes I tell some of my patients that they do what we call the digestive walk. So mostly after every meal, they take a 10-minute walk, because that way the cells get hungry, all the food, by the time the digestion is over and then it converts into simple sugars, the cells are ready to actually absorb them. So sometimes I've told people, and then they've had incredible results just by doing what we call the digestive walk, where they after every meal, they just take a 10-minute walk, and that actually even help them to even settle down.
Then I'm glad you're ending with that, because I'm only over this last question. Well, there are other questions we didn't get to, but is there an exercise routine that would help with what you were talking about earlier, balance, flex, strength, aerobic, and the balance? Is there an exercise routine, maybe a simple one, maybe they don't want to go and do like the whole 2-hour routine at the gym? Is there something that maybe you could do at the house, or a simple one if they do have a gym or something like that? Is there something that you would suggest?
I think that the most practical way is that tomorrow they should come for the breakout session. So yes, and then the 5K, you just come tomorrow, we have a breakout session and we're going to do practical demonstrations of it. But even for that, simple things like brushing your teeth and trying to stand on a single leg in the morning. By the time you're done, how long does it take for you to brush your teeth? 2 minutes, right? So within 2 minutes, try to stand on one leg and try to balance off. If you don't have that, sometimes when you're doing something, I always tell people just on a single leg, just use one finger on a wall just to try to strike a balance. And after you get better, you take the finger off. Those are some of the things that actually you can actually work to get on a balance. Sometimes I also tell people just to do something like a simple obstacle course. And we can just demonstrate that, where we have, like, you can have a stack of books, like in a 4 square, like a cross, and then you step forward, you step sideways, you step backward, and then you're gonna see that for most people, if I should demonstrate, you see that when they step forward like this, they are okay. But when they have to step sideways and then they step back, you realize that they have a challenge. So if you have a stack of books in 4, the goal is that you should be able to do the whole square, forward, side, back, and back to this way in less than 15 seconds. That's the standardized test. So if you can do it within 15 seconds, you have, the data shows that you have a much, like about 99% less fall risk. But for those who have to take more than 15 seconds to make that fall square to come back, they always have a higher susceptibility of falling, especially. And for instance, if it takes you, like if I lose my balance and I have to take 1, 2, or more 3 steps before I can regain my balance, you have a 90% chance of falling. So if you want to train that, you can actually use that as a simple way. You can just have 4 books or anything that you can have and put it like a cross, and then you step in that manner. You can do clockwise and counterclockwise, and your goal is that you should be able to get to do that in less than 15 seconds. That's another simple way of training your balance.
Thank you so very much, doctors. And just want to point out again, like Dr. Ben says, we do have breakout sessions tomorrow, so please come tomorrow. Then before that, there is a 5K that's not going to be here. It's going to be right down the street at a local park. So if you need directions, just ask, and we will tell you how to do that. Thank you, gentlemen, for the answers and the deep conversation. We're going to take another break right now because we want to get you up, moving, not sitting too much. We'll make it about 5 minutes. 5 minutes, we'll come back, and we'll have our next session.
Thank you.